Hey guys, this is Andrew Lee, your health insurance guy, and today's video is going to be about the pros and cons of Medicare supplements. Now, I did another video about Medicare Advantage and the pros and cons of that, but people also want to know the pros and cons of having a Medicare supplement. Now, if you don't know what a Medicare supplement is, it's a supplemental policy through a carrier that will cover the exposures left behind by Medicare Parts A and B, which is generally known as Medicare or Original Medicare, the red, white, and blue card that you get. So A and B covers doctor visits in hospitals at 80%, but who's going to cover the rest of the 20? So let's say if you had a $1 million hospital bill, you're on the hook for 200,000 of that, and that does not go away every single time that an incident occurs. So if you had another $1 million hospital bill, it's just a terrible year in terms of luck, and you have $100,000 or $1 million hospital bill, let's say the next month you already had that previous $1 million hospital bill, you're on the hook for another 200. So what do we do to seal that gap, right? So we get something called a Medicare supplement plan, also known as a Medigap. So I don't want to confuse you with all the letters in the alphabet. But there are specific plans that are also in alphabetical order that are supplemental plans that are offered through carriers. So what are the pros and cons of having a Medicare supplement plan? Well, number one, again, like I mentioned, it does help pay for what you're needing in terms of medical assistance, right? So if you need to go to a doctor, it's $100. Guess what? You're on the hook for 20 of it. But if you have a Medicare supplement plan, generally, let's say for example, a Plan G, which is a $240 deductible that you have to take care of in 2024, and that's pretty much it. Besides your premium, right? So and of course, medication and dental you would have to get on the side. But the pros are, heck, you can go wherever you want essentially that takes original Medicare. About 97% of doctors take original Medicare. So you won't really have an issue with having to stay within a medical group and having to stay with specific doctors and not having to get prior authorizations for certain procedures, and also you don't have to get a referral to go see your specialist. So you're free to roam, right? It's what we call sort of the peace of mind plan, right? Um, it helps pay for out of pocket costs not covered by original Medicare, like I mentioned, that 20% gap. And also, it simplifies billing, makes it easier to manage your expenses because you know what percentage is going to be covered. You know that you just have to pay your Part B deductible, let's say with the Plan G, and you're all good to go, right? There's no copays or anything like that. It's just a deductible you have to meet if you're on a Plan G, for example. I mean, this is going to be a good position to be in, or a good plan to have if you have multiple specialists spread out into many medical groups, right? If you have just a one doctor, maybe a Medicare Advantage could be an option for you. But if you're like, hey, I don't want a Medicare Advantage. I don't want to even be part of, an HMO kind of system. Where of course Medicare Advantage does have a PPO as well too, but a PPO still restricts you to the medical group within the PPO, or the network within the PPO. So the PPOs have a network themselves, whereas with a Medicare Advantage or Medicare supplemental plan, or just original Medicare in general, you're free to roam, right? It's original Medicare. That's insurance that's given through the federal government, and then you have the carrier to supplement what's missing from what the government gives you, just to keep it simple. Of course, if you're traveling and you're a snowbird, um, and or you just love traveling, and or you have family in a different state, whatever the case is, you're still gonna have access to care as you're free to roam. So those are the pros. Those are the reasons why people would consider going with a Medicare supplement plan. Heck, in a perfect world, I wish everybody had a Medicare supplement plan. just because if it's just a deductible you take care of, and of course after that everything is $0, I mean that's a pretty good deal in my book. The only thing that we do have to decipher is what plan is going to be good for your medications, because that could be a pretty big expense itself, and what to do for other ancillaries like dental, vision, and hearing, because you would have to individually enroll into those respective plans. Um, so that'll bring us to the cons, right? I mean, you do have to itemize your carriers in terms of coverage when it comes to building a proper Medicare supplement policy. But of course, it's going to be expensive as well too compared to a Medicare Advantage. Generally, there's a premium associated with having Medicare supplements on top of the Part B premium that you're already paying. And it can go up with age, right? Now, every carrier will have different pricing and, of course, different reputations. But for the most part, it's gonna be a similar experience, because all Plan Gs, all Plan Ns, all Medicare supplement plans that have a plan with the letter on it are built exactly the same as long as the letter is the same. So if you're switching from carrier A to carrier B and you're on a Plan G and you just switched over from carrier A to carrier B, still on a Plan G, you're still gonna have the same exact benefits. The government, even out the playing field so that you can so all plan G's, all plan N's are built the same. So just know that when you're switching plans, that will be the case. Um, Again, a lot of people get tripped up on the fact that they have to get a separate prescription drug plan. So um, if that's really the biggest issue, of course, consult an agent like myself so that we can go ahead and walk you through which prescription drug plan standalone plans, the Part D, which one is going to be good for you. So um, you'll of course still have to pay out of pocket up until you hit your 240 deductible. So let's say you go to the doctor and the doctor visit was supposed to be 150. Guess what? 240 is the deductible, right, for 2024. So that's what we're gonna have to pay. But also, if you have $1 million hospital bill, guess what? You're paying $240. You're just paying the deductible, right? And again, this is a Plan G I'm mentioning if I have to pick one. So again, that's sort of a con in itself. One other thing is if you're in a state where they don't have a birthday rule is when you can apply at a certain period after or before your birthday month to qualify for guaranteed issues if you've had um, pre-existing conditions from before. If you have cancer, heart attack, stroke, anything that's going to really kick you off from underwriting, you do have the birthday rule that you can incorporate. But if you don't have the birthday rule, then switching a plan based off of, hey, my premium just skyrocketed to 700, 800, $900, and I need to switch plans. What do I do? Well, unfortunately, if you're not in a a birthday rule state and you don't have that guaranteed issue to switch over to another plan, I mean, the plan that you're on is the plan that you're on unless you decide to go to a Medicare Advantage. So some people don't like that. Again, the biggest con is the premium. Some people that don't want to pay additional premiums on top of their Part B, completely understandable. I mean, you've worked your whole life to get, Medicare coverage. We've been paying taxes into it too. But some people are like, hey, why do I have to pay for another supplement? So those are sort of the pros and cons of having a Medicare supplement. Again, the pros: you're free to roam, peace of mind, all is well. Just have to get a separate prescription drug plan for that and to take care of that part. And then again, more ancillaries like cancer or home health or anything like that if you want to add that on. Um, so your Medigap policy, just think about it as if it were a safety net, right, for that 80%, so that you're still technically on original Medicare, so you're not relinquishing your Medicare or original Medicare rights to Part C, which is Medicare Advantage. You're still going to be on original Medicare. They're just helping you out with that 20%. So that's the difference between the two. Medicare Advantage has its own respective networks and medical groups, whereas original Medicare you're just sort of free to roam. So um, hopefully that helped out. Those are the main pros and cons of a Medicare supplement. I'll make another video on this going deeper into it, but I just wanted to make a quick, simple video so that you know the difference between Medicare Advantage and Medicare supplements and the pros and cons of a Medicare supplement plan. If you have any more questions, feel free to reach out to me. My direct dial here is 323-844-8471, or you can email me. I'll give you my personal email, andrew@healthmutualnetwork.com. And what I'll do is I'll do a needs analysis with you to see which plan is going to be the best fit for you. Because if you're already, sold on the idea of going with a Medicare supplement plan because you see how effective the policy is, then it's my job to find out which one's going to have the lowest premium and which company has the best reputation and the best customer service and the best client experience. So hopefully this video helped out. Feel free to like, subscribe for more content just like this, because I definitely want to share what I know with you guys, and hopefully this video very much helped, and I'll see you guys at the next one.